Welcome back, viewers of PureFit Living. Did you know that heart disease is the leading cause of death for men and women in the United States? Heart issues do not happen immediately, and they don't always come with warning bells like pain in the chest, breathlessness, or palpitations. Knowing the early warning signs of heart disease can help you before it's too late. In today's video, we will tell you early signs you may be at risk for heart disease. Your heart is the most important muscle in your body, so let's keep it beating strong. An upset stomach might manifest as a stomach ache, vomiting, or acidity. However, if you believe that your last meal should not have led to these symptoms, then it is important to get medical attention. It's easy to dismiss an upset stomach as something trivial, but don't be too quick to grab the antacids. If you experience persistent stomach issues without a clear cause, it might be your heart trying to send an SOS. Better safe than sorry, right? A persistent cough doesn't always mean your heart has a problem. It's important to remember that coughing is a natural reflex that helps clear your airways of irritants and mucus, because it's a common symptom of many things like a cold, the flu, and bronchitis. These conditions can cause your body to produce excess mucus, leading to a cough that lingers. However, if you've been hacking away for weeks without relief, it could be more than just a stubborn cold. Persistent coughing can be a sign that something more serious is going on in your body. A never-ending cough can be fluid building up in your lungs, which is a sign of congestive heart failure. This condition occurs when your heart isn't pumping blood as well as it should, causing fluid to accumulate. The cough is caused by the irritation in fluid, which is similar to shortness of breath. This can make it difficult to breathe and can be quite distressing. If your persistent cough feels more like a plot twist than a minor inconvenience, it might be time to give your heart some attention. Don't ignore the signs your body is giving you. If your cough has overstayed its welcome, it's worth checking out. Consulting with a healthcare professional can help determine the cause and the best course of action to take for your health. Just because you sweat doesn't mean you're going to have a heart attack. However, sweating, especially cold sweats, could mean a problem with your heart when you're not doing anything physical, particularly when there's chest pain along with it. Sweating while you're sitting still or even while you're sleeping could be your heart's way of telling you it's working overtime. If it's happening out of the blue, it's worth investigating. If your body is acting like it's running a marathon while you're just chilling, it's time to call in the pros. People who suffer from heart ailments may experience bouts of anxiety and heart palpitations. Studies have also shown that people who deal with extreme anxiety from very early in their lives are more prone to heart disease. Another common symptom of anxiety is an abnormally increased heart rate, also known as heart palpitations. Anxiety can be sneaky. If your anxiety feels more like a heart-pounding thriller than a mild inconvenience, it might be more than just your nerves acting up. If you feel like your heart is trying to escape your chest, it's worth checking out. General achiness or a cramping sensation in your legs can be a sign of peripheral artery disease, or PAD. This condition often goes unnoticed until the pain becomes more frequent or severe. PAD is a form of cardiovascular disease that's characterized by constricted blood flow to the extremities, including your arms and legs. This restricted blood flow can lead to significant discomfort and even more serious health issues if left untreated. Oftentimes, the pain will occur during physical activity and subside with rest. This is because your muscles need more blood flow during exercise, and the restricted arteries can't keep up with the demand. PAD is more common in smokers and people with diabetes. These risk factors can exacerbate the condition, making it more likely for individuals to experience severe symptoms. It's easy to blame leg pain on a tough day at the gym or a long walk, but if it keeps coming back, it might be more than just muscle fatigue. Persistent leg pain should not be ignored, as it could be a sign of a more serious underlying issue. If your legs are consistently giving you grief, it's worth getting them checked out. Early diagnosis and treatment can help manage the symptoms and improve your quality of life. Don't wait until the pain becomes unbearable. Consult a healthcare professional to explore your options. Swollen ankles or feet can be a symptom of heart failure. Of course, many other conditions, including pregnancy, can cause swelling of the lower extremities, so don't panic. However, if your feet or legs are constantly swollen at the end of the day, mention it to your doctor. Swollen ankles can be easy to dismiss, especially if you've been active. But if they're puffing up like balloons on a regular basis, it's time to take notice. If your ankles are swelling up for no apparent reason, don't just brush it off. It's normal to feel tired after a day of hard work, but it's not normal to feel completely wiped out after just getting dressed. Inadequate blood supply to the tissues, a cardinal sign of cardiovascular disease, can cause fatigue. Feeling tired all the time isn't just about needing more sleep. If you're constantly feeling like you've run a marathon just by getting out of bed, it's worth looking into. Your heart might be trying to tell you something important, so don't hit the snooze button on this one. This is one of those symptoms that can have many non-heart-related causes. It could be caused by dehydration or because you got up too quickly. But if it occurs on a regular basis, medication side effects, inner ear problems, anemia, or, less commonly, heart issues could be to blame. Feeling dizzy or lightheaded can be unsettling, especially if it happens frequently. It's easy to dismiss it as a minor inconvenience, but if it keeps happening, it's worth investigating. If you're feeling like you're on a merry-go-round every time you stand up, it's time to get it checked out. Depression is one of the most common problems in the world, and it affects 19 million Americans each year. It is probably not a sign that you have heart trouble, but mental well-being is linked to physical well-being. Many studies suggest that people who are depressed are at greater risk of heart trouble. Depression can make everything feel harder, including taking care of your heart. If you're feeling persistently low and it's affecting your daily life, it's important to seek help. Your heart and mind are connected, so take care of both. Also known as angina, chest discomfort is one of the more obvious signs of an unhealthy heart. If you feel pressure, pain, pinching, or burning in the chest, the heart is a likely culprit. This pain doesn't change with external pressure, and it may occur either at rest or during physical exertion. Even if the pain is not severe, it may indicate serious heart trouble and needs to be followed up on. Don't just brush off chest discomfort as something minor. If you're feeling any kind of unusual chest pain, it's worth getting it checked out. Cholesterol is a fatty substance found in a number of foods and is also made by your liver. High cholesterol can contribute to plaque in the arteries. One of the ways you can lower your cholesterol is by eating a healthy diet. Your physician may prescribe medications to treat cholesterol that also lower your risk of heart attack. Managing your cholesterol is crucial for heart health. Learn more about such foods by watching 11 foods that are dangerously increasing your cholesterol. We associate exercise with a healthy heart, but remember, a sedentary lifestyle is a risk factor for heart disease. Change in your body's tolerance to exercise may be a useful early warning sign of oncoming heart failure. If you notice that you're struggling with activities that used to be easy, it's worth looking into. Don't just chalk it up to getting older or being out of practice. If your stamina is taking a nosedive, it's time to get it checked out. Besides the heartbeat, the involuntary inhaling and exhaling of the lungs goes unnoticed by most people when it is working properly. When it stops working properly, however, it becomes very noticeable. Shortness of breath may result from anxiety, anemia, or allergic reactions, but the underlying cause is usually lungs or heart trouble. A dangerous heart problem may first reveal itself through sudden shortness of breath. If you're struggling to catch your breath, it's time to get it checked out. Better to be safe and breathe easy than to ignore it and face serious consequences. Interestingly, the nerves in the left arm and in the heart can send messages to the same pain centers of the brain. This fascinating connection means that the brain can sometimes get confused about where the pain is actually coming from. It's a phenomenon known as referred pain, so the brain may interpret heart trouble as pain in the left arm or shoulder. This is why it's crucial to pay attention to any unusual sensations in these areas. What might seem like a simple muscle ache could be a sign of something more serious. In fact, pain or pressure in the left shoulder is a classic sign of an unhealthy heart. This symptom is often associated with conditions like angina or even a heart attack. It's important to recognize this warning sign and not dismiss it as just a minor issue. Seek medical attention immediately if you experience sustained pain or pressure in the left arm or shoulder, especially if it is accompanied by other signs of heart distress, like shortness of breath, dizziness, or chest pain. These symptoms together can indicate a serious heart problem that needs prompt attention. Your heart might be trying to send you a warning, so listen carefully. Don't ignore these signals. Early detection and treatment can make a significant difference in outcomes. Always err on the side of caution and consult a healthcare professional if you're in doubt. Sleep